A cancer diagnosis and the associated therapy can actually have an impact on the entire body, even on areas that you might not think of at first, right? Like fertility, also known as fecundity, which is the ability to have your own biological children. In this and the following videos, we'll talk about what this can mean for children and adolescents who undergo cancer treatment and what can be done to protect fertility as best as possible despite a cancer diagnosis, so that your child or you as a teenager will have the chance to have your own children later on. It's not about making a final decision now, whether you want to have children later or not. It's perfectly clear, yes, that you can't plan for that, but it is rather about keeping that door open, right? So that your child or you as a teenager can decide for yourselves later when the time comes. Which risks to fertility actually apply is very individual and depends primarily on which cancer therapy or medication is received, in which dosage and combination, and it also depends on the age at which the therapy takes place. This means that the risk of the planned treatment potentially limiting or affecting fertility is actually different and unique for every single patient, depending on their individual circumstances and medical background. And also very importantly, cancer therapy always comes first. Your treatment team will therefore look very closely at which measures to protect fertility are appropriate and justifiable for your child or you as a teenager. That also means without losing vital time for cancer treatment, and that's exactly why it's advisable for you as parents, or if you are affected yourself, to sit down together with your doctors and clarify before the start of therapy what options you have to preserve fertility as well as possible during the treatment. And also whether that's even necessary in your case, or not. And it doesn't matter whether your child is already in puberty or not yet, or if you yourselves as teenagers are already long past puberty, because for the different age groups, there are also different options, right? Which we will then present to you in the next videos. In addition, you can also get help from certain services, such as for instance the Fertility Protect Network. This is an association of experts and clinics from Germany, Austria and Switzerland that provide specific information and advice. As always, you can find the link to it below in the video description. Okay, so that's a bit about how the whole thing is generally categorized. But that doesn't yet answer the question of exactly how cancer therapy can affect fertility. In other words, what the actual reasons for it are. Well, basically it's the case that the various forms of cancer treatment can damage not only the tumor cells, yes, but also the healthy cells, also in the organs that are important for reproduction. In girls, these are the ovaries, yeah? So here's even just one half of it, and then there's the other one on the other side. And in boys, these are the testicles, also shown here on one side, so on this side, and then of course there's the other one. And these are the organs where the cells are produced that are necessary for reproduction. Egg cells in girls and sperm cells in boys. But if cancer therapy becomes necessary, then the maturation of egg cells in the ovaries or the production of sperm cells in the testicles can be disrupted, either temporarily or even permanently. And sometimes it's then no longer so easy to have children in a natural way. What's more, in the ovaries, in the ovaries and in the testicles, it's not just reproductive cells that are formed, but also sex hormones, which are important for puberty. Most notably the female hormone estrogen and the male hormone testosterone. So if the ovaries or the testicles are no longer working well, then that also messes up the hormones. And that can lead to puberty being delayed or some physical developments not even getting started properly. And that too can have an impact on fertility later on. Another point is that not only the sex organs themselves can be affected, but also areas in the brain, the areas that control hormone production. These areas function like a sort of command center, which ensures that the ovaries or the testicles know what they have to do. For example, radiation to the head can affect this command center in the brain. Then the signals, which then travel down, so to speak, to the ovaries or the testicles, are no longer transmitted correctly. And that, of course, can also affect hormone production. So let's summarize once again. Cancer therapy can impair the function of the ovaries in girls and the testicles in boys, either because the organs are directly damaged or indirectly because the brain is affected. And both can disrupt the production of sex hormones like estrogen and testosterone and impair fertility. But as I said, all of this can happen, but it doesn't have to. And in most cases, after cancer therapy, there's still a good chance of fulfilling the wish to have children in a natural way. So even if there's often very little time between diagnosis and therapy, and you have 1,000 other things on your mind right now, It's good to keep the topic of fertility protection on your radar and to consider together whether you might want to take precautions to have better chances of preserving fertility. In addition, the medical team and the psychosocial team at the clinic can support you in talking to your child about this topic. Or if you already have older children, you can also watch our video on preserving fertility in girls or on preserving fertility in boys together. Maybe that's also a pretty good starting point to get a conversation going. Yeah, and to share your thoughts a bit. So if you'd like, I'll see you again in the next video. See you then.